So with all this thinking in mind, the XLRI PGDM GM 2022-23 batch conducted ReEnvision, a digital transformation case study competition for all tech-savvy innovators and creative thinkers around the country, which garnered a response of more than 3,000 registrations from across the nation. So that was huge. And there are 3 rounds in the competition. After first round only, 20 teams were selected, and after second round, out of all those teams, only top 6 teams become the national finalists and were given the opportunity to give their analysis and solution, followed by the decision of the jury. So now we are here, and we're thrilled as you are to announce the winners of the competition. First of all, every presentation was top-notch. The jury had a difficult time and it had to narrow it down carefully. And it all came down to the innovative approach and the digital mindset of the participants. So here are the winners. First, the second runner-up, Team Cloud Alert from IIM Bangalore, with team leader Vishnu Prakash Kandasamy and team members Anshul Singh and Janani Kosalai. Now, first runner-up, Team Analytical Masterminds from IIM Ahmedabad, with team leaders Shuas Misra and team members Prashit Misra and Anshit Singh. And last, the winner, Team Golden Eagles from IIM Bangalore, with team leader Krishna Rai and team members Arushi Gaur and Dr. Nohat Bardai. So congratulations and well done to all the teams, Golden Eagles, Analytical Masterminds, and Cloud Alert for your efforts, and it was an amazing presentation. And we would also like to thank everyone who showed their interest in the competition, and I would like to congratulate all the participant team. Also, I would like to thank entire CCC team for their effort, and especially Sir Kushal sir for helping us out, and Saurabh for guiding us out through the process. With this, I would like to conclude my speech. Thank you very much.
Thank you, Swadeep, and congratulations to all the winning teams. And now I'll request Sanjana to take it ahead from here.
Hi, Saurabh. Thank you so much. Next, we have Mr. Siddharth Nambiar with us. He leads Amazon's healthcare business internationally. He's passionate about founding and building pioneering internet businesses and has worked across the US, Europe, and Asia. So being from the healthcare background myself, I'm very much looking forward to such kind of initiatives. Mr. Siddharth has also led the product platform and business teams that have launched and scaled Prime Now Plus, Amazon Fresh, to India's largest selection available in 2 hours across Amazon Fresh grocery, Amazon bestsellers in electronics and smartphones, and home and kitchen categories. He has been awarded GQ Magazine's 50 Most Influential Young Indians of 2019 and Economics Times 40 Under 40. A very warm welcome, sir. Over to you.
Thanks, Sanjana. Nice to meet you all, and thank you for inviting me to speak. Couple of quick disclaimers before we get started. First, I'm here in my personal capacity, not representing Amazon. So anything I say is purely my views. And second, both my parents, my mom and dad, went to XLRI, I think batch of 77. So it's kind of cool to come back and talk to you all. So let's see. I thought I'd cover 3 things today. First, I could talk a bit about digital health and how it's kind of transforming the curative side of the health arena. Second, we can talk a bit about preventive health and how new tools and apps are making it really easy for many of us to manage our health. And third, I'd also like to talk to you about, as young MBA students, how you should compete in the corporate world using health as your secret superpower. And I think that the opportunity here is to use many of the tools and apps I'm describing to make sure you're successful in the corporate jungle. So I'll try and keep this to 15-20 minutes so we have time for Q&A afterwards, and feel free to shoot questions in the chat window or so on as I go along, and I'll get to them by the end. Let's get started. So I think digital health on the curative side has three areas. The first is pharmacy. The second is online teleconsultation. And the third is online diagnostics. And from a pharmacy perspective, teleconsultation perspective and diagnostics, you can bring these three together and think of it from a customer's perspective, right? So from a customer's perspective, let's say you have a cold, you have a cough, you have a stomach pain, whatever it is, and you decide you'd like to speak to a doctor. Now, in the offline world, you would end up with calling a local doctor, trying to get an appointment, hopefully getting an appointment the same day or the next day, showing up at the clinic. Maybe you go through traffic. Maybe you have to wait in the waiting room for 15 minutes, an hour, 2 hours. When the doctor sees you, decides to do a couple of tests, you go to the testing center or lab, which may be some distance away. Traffic again, waiting time again. You get your blood drawn or whatever other samples. You go home, you wait for a day. At that point, you may get your results, and then you have to go back to the doctor. Keep in mind, you're still suffering at this stage from whatever the ailment is. You go back to the doctor, there's still traffic, there's still a waiting room, and at this point, the doctor hopefully prescribes medicines to you. You then fight your way back through traffic, get to the store, buy your pharmacy stuff, and then you're hopefully better. A few days later, you may check in with the doctor again, depending how the symptoms are. Now, the reason I bring up how painful this is that we're now seeing a number of innovations in this space where the internet and digital health can compress timelines and increase convenience for customers. So as you've probably seen already during the pandemic, you can now find a doctor online from several platforms in India and here in the US. And some of those platforms include players you're all familiar with. Now, if you could find a doctor within 1 minute or 5 minutes online, sorted by specialty, sorted by capability, and then within a few minutes of the consult, assuming they can diagnose you online, you're able to get a prescription. If the doctor needs to examine you physically or get a sample, you even have the option of sending a phlebotomist or nurse to your house. Some people are now doing this within the same day, within a few hours. I know of startups in India who are now doing this within a few hours. You then give your sample, having seen the doctor in a few minutes, having given your sample in a few hours, never having left your couch, if you will, and then the results show up within the same day using technology that allows the lab to process things in real time and send it back to you. At this point, you're able to send it back to the doctor if you're on a platform that's fully integrated, and the doctor can see it in real time as soon as the machine has the lab results ready and give you a prescription or a advice within that same hour. We're now taking this long cycle time of several days and compressing it to minutes or hours, depending on the diagnosis. And this is something that I think is super exciting when we think about what may be the future of health from a curative perspective. There's another side to this. Many of us live in large cities. But if you think about, for those of us who maybe have relatives in small towns or grew up in small towns, it was always hard to access specialists, people who maybe are cardiologists or nephrologists or endocrinologists or surgeons with a lot of experience in a certain area. And this access issue became, a train ride or a bus ride or a plane ride all the way to a big city. And then you would have to spend time running around between hospitals, trying to find the right surgeon or senior doctor or specialist. Now, several large hospital chains in India have apps that allow you to find the right doctor already on the app, consult them for a relatively small fee that doesn't involve any travel or waiting time, and then get the advice you need and make the decision on whether you want to have a procedure or not. We can't overestimate this. It's remarkably efficient relative to what the past used to be, where people had to wait for days and incur a lot of time to go and consult these specialists. So again, we're seeing a compression over here. Now, the dark side of this, of course, is in the US, we've seen the FDA bring cases against several online health players, where they were prescribing drugs without enough of a examination, without enough of a diagnosis. And some of these drugs may have been easier to prescribe from a psychiatric perspective or stimulant perspective, and so maybe induced more profit-making motive. And so we have to be careful here that rules, regulations are observed. We have to make sure that each of these companies, for example, have a senior doctor who's responsible for quality and responsible for compliance. And I know that in India, there are telehealth guidelines to make sure that quality is always sort of maintained and only licensed doctors are on the platform. So that's kind of the balance between convenience and quality and safety from a telehealth perspective. So let's switch gears. There's another really exciting space on the preventive health side. And from a preventive health perspective, there are several new technologies that have proven clinical efficacy in clinical trials. And I'm going to connect some of these apps and some of these ideas with some of the points I have for you folks in the third section, which is how can you become the fittest corporate warrior when the rule of corporate survival is survival of the fittest. So pay attention to the apps and maybe make a note or download them, because I think they're really exciting and useful for all of you in your careers. So first, let's talk about weight loss and just body mass index, right? Almost all the big three conditions, which is cardiovascular disease, hypertension, and diabetes, are tied to a higher BMI or body mass index than is optimal. And in the West, this is called obesity. In India, it's called overweight. Whatever label you give it, you should be at your ideal BMI, or else you will find you're more liable to have one of these chronic diseases, which in the wealthy world, and for most of us, is going to be what gets us in the long term. It's not going to be a traumatic incident or a sort of infectious disease. So how do you end up staying away from this when you have a stressful corporate life? The app that I've found has really interesting insights. It's called Noom, N-O-O-M. And this has a variety of proven psychological tactics to help people lose weight and keep the weight off. And this is a combination, obviously, of nutrition and exercise. Now, there are many apps out there that let you log what you're eating. And there are other apps that let you, choose your exercises and maybe keep you on an exercise regimen. But Noom, I've found, is the only platform that connects using technology a daily set of habits along with nutrition and exercise, and wraps this up in a set of psychologically proven techniques to help you reframe what that means for you. And it's kind of all in our minds, right? It's not really about how hungry we are or not. It actually comes down to how we think about food. And I think what Noom has done with several studies is that they've proven that you can lose weight and keep the weight off for several years by using their app. And I found this remarkable because obviously using the app is far less expensive than using dietitians, using doctors, using trainers, and so on. And therefore, I thought this was a fascinating example of how public health objectives could be accomplished with technology. The second sort of set of apps I want to talk about are around anxiety and mental health. So in India, you'll hear a lot people talking about stress, people talking about work stress, academic stress, family stress, you name it. We're all stressed out all the time. And I think that in the West, increasingly, people are referring to these with more specific labels, whether it's anxiety or various type of neurosis. And I think while I'm not a doctor, I work a lot with doctors. One of the things I've realized is that we don't pay enough attention to our mental health early on. And you can kind of vaccinate yourself against stress using a few of the newer apps out there. So I'm going to mention a couple. I obviously don't have any tie to them. I'm just mentioning them because I found them useful personally. And I think they're great examples of how technology is working in digital health. One is called Wake Up by a neuroscientist called Dr. Sam Harris. And the other is a British app called Headspace by a meditation thinker called Andy Puddicombe. Both have millions of downloads, both have a lot of data around them. I think I crossed something like 6,000 minutes meditated recently. And as someone who grew up in India and lives in the West, I think the big aha moment for me was I grew up with some yoga, with some meditation, just because you're growing up in India, but you don't realize how much the ups and downs of life can affect you until you've meditated and seen that, oh, wait, the same ups or downs that happened before don't seem to impact me as much when I'm meditating regularly. And I found that to be particularly powerful. And as you look at the clinical studies around it, it turns out that there's a lot of evidence that whether it's called mindfulness or it's called meditation, people have lower amplitude of emotional volatility when inevitably life, whether it's family or career stuff, gets you. Here's something else that people won't tell you, is that the more senior you get, the more responsibility you get, the more the stress goes up. Because your locus of control, the number of things you're responsible for when you're relatively younger, relatively less responsibility is here. And then as you get more senior, it's there. But what you can directly control when you're more earlier in your career is here. You can't control that much more when you're senior. You just become responsible for things that are outside of your direct control, and you have to influence things, whether it's the government or whether it's extrinsic factors like your industry or competitors. And that becomes really stressful. And so those of you who choose to have a mindfulness habit, maybe using these apps or other digital tools, will find that it's a very powerful vaccination, if you will, against the inevitable stresses of life. And I hope that's a useful habit we'll come back to as I talk about succeeding in the corporate jungle. The third area, also within mental health, and which is increasingly getting a lot of traction, are AI bots. There's a funny story, I can't place the source, there's a funny story that says the most successful AI bot, which got the highest feedback ratings, like a chat bot, was one which said, tell me about your feelings. And anytime you punch in, I'm feeling sad because my speech didn't go well, the bot will respond back with the exact same line and a question mark at the end saying, so you're feeling sad because your speech didn't go well? And the person would be like, yes, I really wish I'd worn a gray suit instead of a blue suit. And the bot will say back, so you wish you wore a gray suit? And the feedback ratings, the sense of being heard, the sense of being understood is so high, even though it's a bot, that it has the highest sort of feedback ratings. So there are a couple of startups here as well. One is called Wobot, one is called WYSA, W-Y-S-A, which are very intelligent bots that use principles of what's called cognitive behavior therapy. And using CBT principles, they're able to take the usual anxieties that all of us face day to day and make it, using principle of CBT, reframe it, remove catastrophization, remove snowballing. There's a bunch of techniques that they've been able to use that have been very powerful and have clinical efficacy. And the really interesting thing about that, in India, for example, mental health has become a big topic in the medical community because we don't actually have enough experts in that space, enough doctors in that space as a ratio of people. So you have to move to digital tools. And so for those of us experiencing very stressful events in life, I would urge you to use tools like that if you don't already have a professional you can access. And I'll refer to this again in your corporate warfare sort of paragraph that I had. The next area that I want to talk about in public health is called Ping An Healthcare, which is the Chinese insurance company. It's the largest health insurance company in China. It's called Ping An, P-I-N-G space A-N. And what they've done is they've built a machine doctor. And what the machine doctor does is that a patient can show up on phone or on text or in person and talk to the machine and say, I have a stomach ache or I have a leg ache or whatever. And the machine has been trained using machine learning on thousands and thousands of doctors and millions of consults. So the machine already knows for each given symptom what the next set of questions are in the decision tree to sort of get to what the right diagnosis is and will assign a probability value of certainty to it. Now, this seems really strange, right? How can a doctor who has many, many years of training be replicated by a machine? And so that's one debate. But the other side of the debate is the average primary care doctor in the manual of medicine in the US has to memorize 14,000 different conditions that have to be diagnosed. But the average doctor can only remember 3,000 or 4,000. There may be, of course, outliers. So what the machine can do is it catches the tail events. The probabilities are low, but when it is diagnosed, it's helpful because then you don't get the wrong medication. And that's something that the tail that machines are better at than human beings. Now, of course, you can argue, but the more complex issues, maybe the machine will not do as well as the doctor. And I'm not making the argument either way. I'm just pointing out that hundreds of millions of people are served by Ping An Healthcare today. And what they've done is the insurance company used to employ doctors because they're providing health insurance. And now the number of doctors needed used to keep going up linearly along with the number of people insured. And that linear correlation is no longer happening. They're able to take on more and more triaging or early stage patients using the machine. And where the machine's confidence level is low, it gets passed on to doctors. So in a way, you're freeing up doctors to do more high leverage work rather than just saying, okay, cough and cold, here's an antibiotic if you have an infection and move on. And so the doctors are now freed up to do more of the high ambiguity tasks that the machines are not good at. And this represents a massive opportunity in parts of the world, the bottom, let's say 3 billion people who need to travel a day or two to get access to a highly qualified doctor. You can imagine that the machine might at some point be a better alternative than the local shaman or the local traditional doctor who may or may not have empirical evidence to help their patients. So that, I thought, was another wonderful innovation that's worthy of discussion. Finally, from a reversal perspective, there's 2 or 3 new technologies out there that I think are really exciting. You might know that in India, we have the largest number of diabetic people in the world. And this has something to do with genetics and something to do with our diet and something to do with how much we enjoy exercising or chilling, either way. But I think the really interesting developments have been a couple of startups. One's called Fitterfly, the other is called Twin Health, which have shown through clinical studies that they can reverse diabetes, obviously not the genetic type, but the type from lifestyle. And by reversing diabetes, they're able to lower your H1BAC, which is sort of a proxy for the amount of sugar in your body and how insulin's able to counteract it. And so I would find this remarkable because obviously living as a diabetic is particularly challenging. And as you age, it creates a number of other secondary side effects. And the ability to catch this early and be able to reverse it is really powerful. And for those of you who are now in your late 20s or early 30s, there'll be a certain percent who are pre-diabetic. When you do your blood test, you'll find out that your sugar levels are higher. You can actually go on these programs today, whether Twin Health or Fitterfly, using your blood reports and actually measure over time how it comes down using their therapies. They use technologies like a CGM, which is a small device you can plug into your tricep, and it'll measure your blood and tell you how your diet's affecting your blood. And then a nutritionist will help you modulate that. The other big area is cardiac disease, where there are a number of startups who are experimenting with how nutrition, particularly different diet types, can reverse and certainly stall arteriosclerosis or cardiac disease, which is the single leading killer for wealthy populations. Finally, all of us at some point in time, I think the metric is 76% of people in the US at some point in time in their lifetimes will report LBP or lower back pain. I know I've certainly struggled with back pain over the years as we've traveled a lot for work or as you've spent a lot of time at desks and you're not exercising enough. And I think what you'll end up finding is that great new startups like Kaya, K-A-I-A, or Amada are able to, and there are many others, by the way, just search for it online, are able to give you a physiotherapist, but a machine physiotherapist, which doesn't cost as much as a real physiotherapist, suggest the right exercises. And whenever you need to access it, you should be able to access a physiotherapist whom you can pay on demand. and that's able to reverse back pain and take you to a pain-free state. Now, across all of these, curative, preventive, and reversal, these technologies are rapidly evolving. So everything I'm saying will probably be outdated in 3, 6, 9 months. But my point was still that digital health has reached a level where it's not just an exciting new industry, but for those of us who are excited about a sense of meaning and altruistic mission in our careers, it represents an opportunity to alleviate pain and suffering while at the same time be able to work really hard at the cutting edge of consumer and technology. So finally, I'll bring up personalized medicine. There's obviously the promise of genetic testing and DNA testing that's been floating around for 10 years. And now in the West, there are several companies like 23andMe and others that will tell you if you have a predisposition for chronic diseases, and you can find out early and modify your behavior and your health habits accordingly. So this is really interesting because now some of them are also selling, for example, a company called Viome, V-I-O-M-E, is also selling personalized multivitamins, right? So you're able to get a blood test, able to get a genetic test, and after you send them your samples, they'll send you multivitamins in a box that are customized for you. Because it turns out Sid may not need 1,000 milligrams of vitamin C, I may need 2,000 a day, but Sanjana might need 200 a day, and that might be an example of a personalized multivitamin. Let me wrap up by talking a bit about your careers. One of the things I wish someone had told me when I was coming out of an MBA back in 2007 at Oxford is I wish I knew how important it was to compete with energy levels and to compete with diet and to compete on exercise, because all of those daily habits on meditation, on weightlifting, all of those daily habits show up at the workplace. And let me explain what I mean. As you age and as you become more senior, what I have noted, personal experience totally, but many of my friends would agree around this stage in your career, is you get to your late 30s, you get to your early 40s, you're responsible for kids, you're responsible for parents, you're responsible for your career, and you're responsible for taking care of yourself. And most people put taking care of themselves at the bottom of that pyramid. And what ends up happening is you end up seeing heart disease, and you end up seeing diabetes or hypertension showing up very quickly in the late 30s and 40s. And you start seeing people who are doing great in their careers flaming out. They're just not able to keep up with the stress. They're not able to deliver, not able to perform. They take more leave of absence. They have surgeries. All of that stuff starts happening. And then you see them going to spas, or you see them going to retreats and taking vacations to try and recover from stress and then come back to a very stressful lifestyle. So here's what I would recommend, again, not being a doctor, but just speaking from personal experience and looking at lots of data. I would recommend start early. I love this book by James Clear called Atomic Habits. And in this book, he suggests you can start all habits. If you want to be, I don't know, meditating for 10 minutes every day, start with 1 minute a day and work your way up. If you want to be working out every day, start by putting your shoes on, going to the gym for 5 minutes and then leaving, and ideas like that. And there's several great podcasts he has. But the bottom line is this: if you are not meditating, if you are not weightlifting, if you are not doing some form of cardio, you're probably not going to compete and win against those who are. And if I look around me at the top performing CEOs in Silicon Valley, many of whom are Indian origin, by the way, or in the world generally, you will see each of them has a team that consists of someone for mental health, someone on physio, someone who is taking care of their spiritual stuff. They build a team around them, and that team keeps them on track. And for those of us who can afford it, great, we should do that. But for the rest of us, I would highly recommend some of these apps. Digital health has come a long way from a preventive perspective, and I'd encourage all of you to not only vaccinate yourselves, but compete and win and fly the XLRI flag by winning, by using some of these digital health tools. That's all I had. Thanks very much. Over to you, folks.
Thank you so much, sir. It was very insightful. So now we'll be opening the floor for questions. But before that, being the host, I would like to take a little advantage here to ask the first question. So my question is, I'm already aware of digital apps in the market like MediBuddy and all. And yeah, I've even done a few projects on digital health, but I've never been convinced by the fact that digital health can ever replace the personalized touch of a doctor. Especially in India, when we ourselves do not know the symptoms, how can we explain it to a laptop or a virtual doctor? I understand in COVID times, the market size might have increased for digital health apps. However, do you think it will continue in the future?
Yeah, that's a great question. Thank you for asking. I would break this into two parts, right? First, there are a set of conditions which primary care physicians have surveyed and practiced during COVID especially. And for that set of conditions, I believe in the US, it's 60% of the conditions that they see volume weighted. For that set of conditions, there is a lot of clinical evidence that there's no difference in efficacy between telehealth and real sort of doctors treating you physically. And for the remainder 40%, which are well known, you need some kind of in-person interaction or diagnostics. And here you might imagine online players can send someone to your home to take care of this. And then you raise the percent up to 80, 85%. Now, my numbers may be off depending on which country and depending which physician, but broadly they should hold true. Based on those data points, it would seem like it seems inevitable because physicians as well as patients benefit from, for that 60% or 85%, benefit from the higher efficiency and utilization of digital sort of platforms. That said, these things tend to be generational, right? Younger people tend to adopt new technologies. Older folks who are used to using things a certain way may not change for a while, and that's okay. I just think that it represents an opportunity, especially as I mentioned, for folks who don't have access in rural areas or who cannot otherwise see someone with the right qualifications. I think it's a powerful new technology that benefits society. Who wants to go next?
I think that makes sense. It's all about customer perception. Before that as well, Amazon has proved when it changed the perception for e-commerce, I'm sure it can do that for digital apps and all that as well. Now let's move on to other questions. I can see a few hand raised and expectedly most of them are from females. So first question is from Divya. Divya, would you like to come up for your question and unmute yourself?
Thank you, Sanjana. Hi, Siddharth. Thank you so much. Knowing that you're in a different time zone and addressing all our batch feels really great. So here is my question. Over the last couple of years, the need for digital transformation has increased exponentially. Is such a rapid growth for transformation creating new issues while solving the old problems?
Absolutely. I think as with any new technology, any new platform, there's a lot of risk and you have to manage the risk carefully. I think there's 2 or 3 stakeholders involved, right? First, the government obviously will regulate things. And in each country, there are regulations in the US and Europe and India, China. There are regulations to protect consumers, as well as make sure that doctors have the right incentives in place. Second, there are responsibilities that doctors, hospitals, and clinics have to make sure that when they're administering digital health, they take the right precautions, because you obviously can miss some things that you could see physically, right? And you may miss that in a video consult or a phone consult. That said, here's an interesting statistic. 90% of digital health interactions in India, and my data may be a year old ballpark, take place on WhatsApp, informal phone chats that doctors have with patients. The actual formal platforms are actually 5 or 10%. And this means that the tools and the guardrails that exist on these formal platforms with maybe quality teams and supervision and all of that do not exist on these informal channels where people are just calling up or messaging their doctor. So there may be some benefit to organizing this informal sort of area. And third, I think consumers, as ever, need to be beware, sort of, as with consuming any other service or product. Medical services, similarly, there's plenty of snake oil out there and plenty of claims, and you have to be careful and judicious when making decisions as a consumer. Is that helpful?
It's absolutely helpful, Mr. Siddharth. Maybe we can take up next question. It's from Dilpreet. Dilpreet, could you please unmute yourself?
Yeah, sure. Thanks, Sanjana. Hi, Siddharth. You were just talking about that how the digital consultation is happening over WhatsApp and other informal methods of communication. My question is around that. So how efficient do you think this digital transformation is in improving customer experiences over informal means of communication, or in general, like how efficient do you think this transformation, especially in the healthcare sector, has been beneficial to the customers?
Yeah, thank you. I think there's a couple of areas here, right? And I should again say my views are my own and not those of Amazon or anyone else. I think there's an opportunity here for those who don't have access to medical care. And we may not realize it if you live in towns or cities, but for the large majority of the Indian population that may live in rural areas, they may not have immediate access to specialists. And you have to understand the way medical profession is structured. You have primary care physicians, which may be available in most places, but you have specialists with deep expertise in some parts of the body or systems, and surgeons who evaluate if procedures will be helpful. And this is very hard to find if you're not in a big city or town. And here, I think, is where there's the largest opportunity from a public health perspective to get access to expertise that you otherwise wouldn't get. Now, for those in cities, as I said, is there a convenience play where you'd normally spend a couple of days and you could compress this to a few hours? Absolutely. And one might argue there are some risks. And it's really up to this ecosystem that's developing quickly to manage the risks while getting the benefits. And I think that's the partnership that's required in the ecosystem between the government, everyone else. Riti Mukta saying, in the lockdown, I guess, digital health was a big help to many people. And I know of several cases myself. Thank you. I hope that's helpful.
Yeah, thank you so much for sharing those insights. Definitely, it reminds us of the lockdown period. And it was really helpful just communicating over WhatsApp and asking what to take when. So, yeah.
Next, I can see a hand of Surbit. Surbit, would you like to come up for a question?
Yeah, thanks, Sanjana. Hi, Siddharth. So we were just talking about different software and applications that used to that will track different people's health and physical health and mental health. Right. My question is more central to India and about centralization of data. Right. So even though we have different applications, right, and even in India, especially, you might be aware that most of the consultation that are done are offline, and the doctor gives a manual prescription, and there is no central database per se, right? Even in big hospital, every hospital has their own software that they use to track patients' history. Right? So it becomes difficult for a person to actually, for doctor per se, to track a patient medical history. Let's say a person 25 years of age, he has went to 15 doctors for a certain disease, and he's coming to a next doctor. It will be difficult for the next doctor to trace his medical history. Right? And because there is a scattered databases all around for different softwares, and even in the hospital, right? All doctors do not have access to a central database where they can take the details of that particular patient 25 years down the lane before and track his medical history and give their suggestions for his particular issue. So I know this is a challenge in India, definitely. What are your thoughts on this? How do you think we can resolve this? This is a long way to go, obviously, especially in India, right? But I just want to know your thoughts on this.
Yeah, I agree broadly with what you said. Again, I'm not a doctor, but I would say that just like any other industry, the extent to which in the healthcare space, we're able to leverage technology to drive the right outcomes, not just focusing on profitability, but rather focusing on medical outcomes, clinical outcomes, that's a great place altruistically to focus on. And so you might say technology that's used to improve diagnoses. For example, you mentioned EHRs or electronic health records. If a doctor could see that Sid had, I don't know, high sugar when he was 32 and 34 and 36, it may not have been diabetic, but it was higher than ideal, might say, hey, Sid, you want to consider a dietary plan that doesn't spike your blood sugar as much. Eat more fiber, eat more vegetables, eat less chocolates, drink less Pepsi, whatever it is, right? And so a longitudinal health record rather than transactional interactions is something that technology can certainly help with, because, you know, doctors change, your neighborhood changes, all of that stuff. Secondly, you can also imagine that there's a lot of patient history. For example, if Sid was on medication X, but doctor wants to prescribe medication Y, doctor can see the interaction between the drugs if there are health records, but may not remember it, or the patient may not remember it at the time. And so you can avoid a bunch of pain downstream from there. So I would argue that you want to focus on clinical outcomes, medical outcomes, and first, and then think about efficiency when using technology. And absolutely agree with you directionally that there's a lot of upside here. Thanks for the question, Surbet.
Thank you, Siddharth.
Next question we have from Yogesh Kadian. Yogesh, can you please unmute yourself and ask a question?
Yeah. Hi, Siddharth. It's good to have you here to share your experience, and was able to connect with you regarding the atomic habits part you just described, how it will help. So I'm also able to follow the same schedule during my this B school hectic schedule also. So my question is to you, like, going digital is a business decision, but the notion of how data will shape employees is a consequence on which the business decision should depend. So I want your take on not going digital only for the sake of being digital, but how to avoid that trap.
Yogesh, thanks for the question. I'm not sure I fully understood. You're saying how to avoid the trap. What's the trap exactly?
Like business companies try to go digital only for the sake of decision, not to understand how it will impact the employees also, and how it will impact their working also. So that's about it.
And so when you say companies try to do digital, what do you mean exactly?
Like my company started one like Power BI software, which have already defined reports which can you pull out from the system. It's instead of making a custom made reports. So a lot of employee faced a really difficult issue in transforming to the new technology, new part. So there was no incentive also.
Yeah, that sounds like a bad technology implementation. I have no idea. I have no idea what the background is there, but I agree with you. That sounds terrible. You should talk to someone who implemented it. I'm sorry, I'm not helpful because I don't have the context.
All right, Yogesh. I think we can move on to our last question of this session. Can I please ask Satish to come up and unmute himself? Satish, are you able to unmute your mic?
Yes, Sanjana.
All right.
So I don't have any question, but I have a thank you note for you, sir. Being on a different time zone and taking on your valuable time and providing your insight was very nice to hear your thoughts on digitization, and look forward to maybe see you again.
Thank you, Satish. That was very sweet of you. So now, sir, I will, from the whole batch and all the audience, I would like to say a big thank you to you, especially for the patience that you have shown for all the questions that we were asking, plus for an amazing presentation and session. Thank you so much and really appreciate your work and efforts.
Thanks, everyone. Great meeting you all. Take care. Bye.
Bye-bye.